What's up, beautiful people? We are trying something new. We're still going to do the clinical studies, probably two, maybe three a week max. But I really wanted to talk about something that I think could be impactful for a wider range of people. And that is utilizing my 20 plus years of taking care of patients. I've been taking care of patients since pharmacy school. That was in 2004 when I saw a patient for the first time as a medical practitioner. The discussions that I've had with patients over the years about all kinds of various things. So what this series is, it's patient journeys, and it's going to give you a snippet of what the discussions are like when I'm talking to a patient about health conditions or health concerns or research or data. And we're going to start with something that I posted on my stories recently, and that is exercise. It's probably my primary recommendation when I talk to people is exercise, trying to figure out how to incorporate exercise into their routine. So I've mentioned this story before, but backstory, this patient came into the big box clinic that I part-time work at, and they had some abnormal labs, and on the labs, they had an A1C that was 6 point something. I think it was 6.2 or 6.3, something like that. But it was in the range of prediabetes. So prediabetes, I don't think is taken seriously enough by the majority of the medical community. We know there's significant health risks associated with prediabetes. In terms that you may have heard, this is the first signs of insulin resistance. It's already showing signs of abnormal blood glucose metabolism, and your hemoglobin A1C is basically a measure of your average blood glucose. Red blood cells are floating around in the blood, so is glucose, and glucose can attach to it. And then we measure basically a percentage of how much glucose is attached to it, and we can use that as a marker of your average blood sugars over the last 3 months based upon the average lifespan of a red blood cell, right? So it's a very common marker for assessing blood glucose and glucose metabolism. Well, in this case, she was in the prediabetes range, and I'm talking to her about the risks associated with prediabetes. And I list, this increases your risk of Alzheimer's, this increases your risk of cancer, this increases your risk of developing diabetes, it increases your risk of developing diabetes complications, and I'm going through my entire spiel. None of it really registers with her until I mention the Alzheimer's disease, because her grandmother or mother or someone in her family, I don't remember, had Alzheimer's disease. And so they say, well, what can I do to lower my risk of developing Alzheimer's disease? And I said that getting your blood sugars under better regulation is the name of the game here. So there's really two key things that are important here: what you eat and how much you eat, and exercise, physical activity. When we're talking about both, exercise is what we commonly think of, aerobics, strength training, but also more movement throughout the day, not being sedentary. And her response was, I don't have time to exercise. And I've seen this happen so many times, and I talked to a bunch of people about this, about do they see the same thing with people when they encourage them to start doing some routine exercise? People get mad at me, and I don't know if it's because I'm a big guy, like I'm usually wearing scrubs, so I look like I'm in shape, or if it's because they feel subconscious about it because they know they're supposed to be exercising and they feel guilty, so it's kind of that type of reaction. But my colleagues who I talk to, they don't seem to have this response from people. So if you're a medical professional, let me know down below. Have you seen this with your patients or clients? Do people get somewhat angry at you when you suggest that they start exercising? I guess the other thing that could be is a lot of people think that exercise still is just for cosmetics. I don't work out to look good. I work out for my mental health, my physical health, and the fact that I still want to be functional when I'm 80 or 90, if God blesses me with 8 or 9 decades on this planet, right? I just want to maintain function. It's quality of life. Exercise is a huge quality of life factor. Not only for me, but like I'm miserable if I don't exercise. So I'm not going to be very fun to be around for people. So exercise is absolutely a must for me. Okay. So she says, I don't have time to exercise. And she does so in a way that, like, incredulous, like, how dare you type of tone. And this is my typical response when people say, I don't have time to do something. I usually try to get them to reframe. And what do I mean by that? Limiting beliefs are a real thing. If you believe you cannot do something, or you don't have time for something, or you cannot achieve something, tends to be a self-fulfilling prophecy. Why? Because everything that you encounter in your environment is now being run through that lens and is going to reinforce it. You'll be like, yep, I don't have time to work out because I have kids. Yep, I don't have time to work out because I got a busy job. Yep, I don't have time to work out because XYZ, right? So everything you see in your environment is going to reinforce that notion. Or you can reframe it. Instead of saying, I don't have time to do this, or I can't do this, or using these kind of negative statements, ask yourself, how do I make this work, right? Ask yourself empowering questions. What do I need to learn? What tools do I need at the house? Who do I need to talk to? Is there knowledge that I need to gain? Who has that knowledge I need to gain? Ask yourself these empowering questions. It seems so silly, but it's such a powerful tool that I've seen with patients over and over and over again. And so in this particular instance, I said, okay, let's just back up here a second. Instead of saying I can't or I don't, or using these terms that have these negative association, let's try something different. What I want you to do is out loud, just say to yourself, how can I make this work? And she was kind of hesitant. And then after a while, she said, fine, I'll do it. Asked herself out loud, how do I make this work? And I just sat back and didn't say anything because I could see the wheels in her brain like start turning. I could see a plan forming. And then about 3, maybe 4 minutes later, she said, okay, here's what I'm going to do. I have this amount of time during this part of the day. I'm going to bring my clothes to work. I'm going to do this. I'm going to do that. And I think I can do this 3 to 4 times a week. Because that's usually my next question, right? Is realistically, and you have to be honest with yourself. This doesn't work if you are not 100% honest with yourself. Realistically, how much time do you have to commit to exercise a week? And where do you think it's best that you can fit it in your schedule? I personally work out in the mornings. I've still been able to consistently work out, even though our son is 5 weeks old now. My wife is also consistently working out. Because if you wake up earlier than everyone, it's a lot easier to get stuff done. And then we just take shifts watching the baby early in the morning. So I was at the gym at 5 a.m., came home around 6:15. She went to the gym at 6:15, came home at 7. And then I started work. She's still on maternity leave. But when she goes back to work, she doesn't typically leave the house till 9. And so, we have a large range of time there where we can both make sure we get our goals in. Of course, that's going to change if we have more kids. But when there's a will, there's a way, right? So realistically, ask yourself, how much time do you have to work out? And I'm a fan of 2/3, 1/3. So 2/3 strength training, 1/3 cardio. I personally do HIIT cardio because I don't like cardio. So I want to get in and get out. So I'm doing high intensity interval training. I do 4 days a week of weights, upper, lower splits, and then 2 days of HIIT cardio. So I asked her, okay, realistically, how many days do you have to work out? She said, well, I think I can do 4. I'm like, okay, perfect. So in that case, if you're going to do 4 days, it's probably best that you do maybe 2.5 days of strength training and 1.5 days of cardio. And she said, okay. And I gave her some resources, some workout builder websites that I know. I usually refer people to Layne Norton's website for a workout builder. I gave her some personal trainer information here in Houston, either virtual or in person. So I just gave her a ton of resources to help her on her journey. And so that is literally what I do in these types of situations. I give people information about what their risks are because I am meticulous about risk. That's why I spent the last 4 weeks developing a spreadsheet for laboratory data. All my patients are going to get access to that. We're going to go over it. We're going to make sure that we're mitigating as much risk as possible through lifestyle behaviors, peptides, targeted supplementation, even prescription medication. one of the things I'll do is I ask people, would you rather take medication? Would you rather take supplements? Would you rather try lifestyle interventions first? Or would you like to do kind of the kitchen sink approach? Because every person is different on their approach. Some people just want to knock the risk out as low as possible, as soon as possible, right? So the whole point of me rambling here was talking about that I don't have time to exercise, and how I hear that all the time, and how I approach that with patients, just to try and reframe how they see their daily activities, and then try to figure out what's important to them. In this case, the lever for this person was preventing Alzheimer's. They did not want to experience that for themselves because they had seen it with a loved one. Now I know what's important to them. Now I can get them to reframe what they're doing around what's important to them. Because how much more sticky do you think an exercise routine is going to be for this person if they're thinking about, I'm doing this to prevent developing Alzheimer's like my family member? I don't want that. I saw them go through that. I'm going to try to lower my risk as much as possible. Much more sticky. So this has been the first patient journeys. I have a whole list of topics to talk about, things I've heard from patients, conversations I've had, things that we try to do as physicians to help people. And I'm hoping that you guys find this helpful, informative. I know some of you have had these journeys, had these conversations. Maybe you took something new away from this. So we'll be back probably on Thursday or Friday with another one of these about a different topic. And I hope to do maybe 2 of these a week. All right. Thanks for watching. God bless. Oh, and I guess I should always be closing. So if you are interested in a physician like me who practices the type of medicine that I do, click the link down below. You can head to heal.me/GHW to book a free discovery call to be a patient in my direct primary care practice, where we focus on helping prevent disease, getting off medications, and longevity from a perspective of how do you train hard, recover faster, and how do you keep your brain healthy. Those are the things that I'm interested in, but the website has more information. So thank you and God bless.